Okay, so in this video, I'm going to be discussing the integration and utilization of dance movement therapy within the healthcare field specifically. So in this presentation, we will cover what the caregiver's role is, and then where and how dance movement therapy is being utilized. So, the caregiver's role. Dance therapists have extensive dance training and psychological knowledge. Like I said in the first video, in 1966, the ADTA was created so that this was made possible, that they had to have training and certifications. The dance therapists specifically look at the shape of the body, the appearance, and the rhythm of the body and utilize this to understand and connect with the patients. They create relationship with the patients that not only help the patient but also other caregivers and then the families. So a specific example of this is Candy Lowe. She was discussing her utilization of DMT with a patient named Jenny. And Jenny was a 9-year-old that had a tumor on her eye. And in order for this to work, the mind and body of the patient both have to be present, and then the caregivers have to understand patients by tuning into them. So Jenny was a little anxious at first whenever Candy came into the room, and Candy utilized rhythm in order to be able to connect with Jenny. And the main problem that they were experiencing was that Jenny didn't, every day it was a fight to get her to be able to change the dressing on her eye. So she utilized dance movement therapy in order to help her cope with that, which not only helped the medical staff but also her family that was having to watch her go through all these sedations and all these procedures. So where and how is dance movement therapy being taken place? Where? It is seen in a various different settings. It's seen in inpatient and outpatient facilities, medical facilities, nursing homes, schools, and daycares. And then how? I have two specific examples. So Nana Coach explains how group work is utilized in dance movement therapy. So it consists of 3 stages: the warm-up, the development section, and then the closure section. And so in the warm-up, all the patients, this is more of like a group type. So in the warm-up, they all start in a circle, and that way the patients and the therapist are seen on the same level, and everybody can be seen. And then during this, there's usually light music playing in the background, and what happens is that the rhythm of the music binds connections. And so the different patients, maybe one has big movements, one has small movements, they all end up being connected because of the circle. And then in the development section, this is where basically the patients and the therapist begin to understand what emotions the patients are feeling through the movement. And then as it continues, they have the closure section. And basically this is taking in everything that happened and gaining like an overall understanding of it and what they were able to accomplish within this specific session. And then the second example I have is an eye tumor patient, which is Candy and Jenny again. And basically, like I said earlier, Candy utilized rhythm to gain trust with Jenny. And then through the utilization that Candy was able to give Jenny, DMT helped her gain mastery of the hospital setting and making her case more bearable for her.